this type of study is clearly the result of teamwork, and as I often say during my trainings, studies like a puzzle, and every piece is needed to complete the image. So what's a CAP study? Basically, CAP survey is a quantitative data collection method that is highly focused in scope and measures human knowledge, attitudes, and practices in a particular topic. They've long been used in public health, but it's a rather new method in child protection. In the case of our study, and notice that I passed from survey to study because our project consisted of a survey, a CAP survey, as well as other data collection methods. We wanted to document the levels of awareness and understanding that adults and children had of particular aspects of child protection, such as existing legislation and protective resources, the risks of inadequate parental care and violent discipline, etc. But we also wanted to know how they felt about those topics and any preconceived ideas that they had about them, as well as their behaviors in relation to these child protection issues. CAP studies are particularly helpful during the start of the activities for a program in order to establish a baseline inventory of the levels of awareness, beliefs, and behaviors in the targeted communities, and also to help describe the context for the intervention. And in fact, that was the first objective of the study. The second objective was to identify resources for vulnerable children in the target counties, as well as barriers and enabling factors that might contribute to violations to child protection and children's willingness and access to prevention services and responses. This map shows where the study was conducted, the areas in pink. The study was conducted in 12 districts in 6 counties in central and western Liberia, including the capital city of Monrovia. The population of these 12 districts together represents almost 40% of the population in the country. So although they look rather scattered, it actually covers a large proportion of the population. This was a mixed method study that had both sequential and parallel features, particularly the survey and the second qualitative stage partly overlapped, not only in time but also conceptually. The idea of triangulating information or exploring the same issues through different sources helped not only interpret the results of the survey but also increase the confidence in our findings and also to help compensate for the weaknesses of each particular methods. Early on in the study, we did a review of literature and legislation and focus group discussions and key informant interviews to focus the study, to conceptualize the data collection instruments, and also to raise awareness about the study and start building relationships that were crucial to then ensure the use of findings. At the end, towards the end of the study, then we used qualitative methods again to collect information on the same topics that were covered through the household survey. And all in all, we did 55 key informant interviews and talked to almost 200 adults and children ages 7 to 17 through the qualitative components. The household survey, there was really one for caregivers and another one for children, was a 3-stage probability survey stratified by rural, urban, and metropolitan. And we reached 1,160 parents or caregivers and 387 children between the ages of 12 and 17. And as you see, the overarching ethics and quality checks were emphasized throughout the study. And I'll provide some examples as we go along. The study and the different components followed a similar 5-stage cycle, and for the sake of time, I will focus on the CAP household survey, but we can talk more about the other components of the study in the Q&A later. So I just mentioned the important role that early qualitative work played in the specification of the focus of the study. Key informant interviews were particularly crucial in the absence of previous estimates of the prevalence of most of the issues that were covered in the survey. And of course, decisions about survey scope are not made in a vacuum, and so the calendar of reins and resource constraints also set limits to research design. So, for example, the geographic scope of the survey was determined partly by what was feasible. This required some negotiations because there was some local interest in extending the study to other counties, but it was just not possible. And similarly, the demographic scope included caregivers and children in private households. That's people who related or unrelated and live together eating from the same pot, whereas institutional and homeless populations were included through the focus groups, the discussions and the key informant interviews, but not in the household survey. We went through scientific review and ethics approval at the C3S de la Montagne, which is a center affiliated with McGill University here in Canada. And my pre-existing relationship with the C3S and the IRB was important because it facilitated obtaining preliminary approval before I traveled to Liberia. And through close communications, we were able to obtain full approval before the data collection started. And so this was important not to delay the study because, as you know, ethics review can take months. Now, in the absence of a local IRB at that time that could perform a similar review of our protocol in Liberia, we convened a local advisory committee, which was chaired by the Ministry of Health and Social Welfare, and it played an important role in reviewing the research design and the instruments according to local regulations and cultural norms. And it was also important to facilitate access to information, to help us access orphanages, and ultimately for dissemination and use of results. So a few tips that I learned in this phase: negotiate and be as specific as possible in study objectives and research questions, and discuss with decision makers the trade-offs that that exist between precision and cost. Also, in the absence of any prior statistics, you may need to use well-informed guesstimates, but be cautious and try to obtain several and average them and contrast them with prevalence information that might exist for other settings, similar settings. Also, develop an ethics plan and maintain open communications with your IRB. It's important to carefully anticipate risks and benefits for participants, and particularly children, and to design a plan that specifies how the informed consent will be documented, how voluntary participation will be respected. For example, if there's a discrepancy between parental and child consent, how participants will be protected from harm. In our case, for example, we made sure that children and adults knew before agreeing to participate that confidentiality would be protected unless the information they told us indicated that they were in danger, in which case the interviewer would have to share that information with people who could help the child. Also, strategically select the members of your advisory committee and consult with them throughout the study, and get in the habit of keeping a diary. The second stage is when the survey instruments are developed and pre-tested and the sampling procedures took place. The desk review and the initial focus groups were key to the development of the first draft of the questionnaire, which then was pre-tested with one of the field leaders, and this contributed to his training. I don't have time to go into the design of the questionnaire, but there were certainly many good tips that emerged from that process in terms of providing clear instructions to interviewers and ways to keep respondents engaged, etc. But pre-testing was time-consuming. It was, however, crucial in the development of the instruments, and as a result of pre-testing, which we did with adults and with young people 12 to 17 years of age, we reduced the number of questions. We developed new response choices that capture the most common answers, and this in turn reduced the need to manually code the other responses at the end. That was very important. We also selected reference points in time and terms that were generally understood by respondents. So really pre-testing is very important. The CAP survey used, as I mentioned earlier, cluster sampling and randomly selected census enumeration areas in the 12 districts. This we did proportional to population size. Then the households within those selected areas were also randomly selected. using the modified AP method, and then respondents within each household were selected with a quiche table. The sample size was calculated to achieve certain level of precision for caregivers and also similar levels of precision by domain. And we used the 2008, which was the most recent Liberia population and housing census as the sampling frame. Now, some lessons from this phase. Random sampling allowed us to generalize results to the entire population of the 12 districts, which was important. However, it requires certain expertise and it was very time consuming, requiring numerous trips to the census office to solve inaccuracies and incomplete data sets, to get the GIS maps, and also because they moved to a new location during the period of the study. So start early, check it carefully. It's very important, very, very important to ensure that all team members understand the significance of random selection. For example, we invited all team members from finance to administrative support to the first day of training. And it's particularly important to involve the drivers so that bias is not introduced unintentionally in the field. For example, if access to a selected community is more difficult than to an unselected community, and there's any temptation to substitute one for the other. Also take time for questionnaire development and pre-testing because it has direct impact on quality. Triangulate across methods and respondents and locations. Make sure that the interview protocols and the survey questionnaires cover all the important outcomes that you're trying to measure. This will help validate the results. And look for ways to involve children meaningfully in the survey. For example, we included their input to focus the study and to refine many of the survey questions. Now, 6 days of training for interviewers and supervisors, because focus group facilitators, data entry clerks received their own separate training, included role plays, lectures, and 2 days of field testing. And the supervisors received additional training on team building techniques, on data management, on map reading. Before going to the field, it was very important to communicate with local authorities at all levels. And this is something that needs to be factored into the timeline because it depended on the random selection of clusters, which in turn depended on our getting access to the full list of census enumeration areas. So it was important that everyone participated in that basic training so that they could understand how these different pieces were linked. The instrument was administered in English or in Liberian English 95% of the times. In the few cases in which a local language was preferred, one team member in each team who was fluent in most common languages in the target districts and mostly Pele was able to complete the interviews. The list of ethical issues that can emerge during fieldwork can be very long, but just to highlight a few, it's important to ensure that the research is understood by children and by adults because expectations of assistance can result in biased responses and in disappointment. Also, interviewers were trained to consider issues of authority and autonomy. For example, if adults had to give some consent before their wives or children could participate safely, and also safe ways to enact dissent. For example, if the parent agreed to the child participating, but the child did not want to participate. Also to ensure confidentiality, interviews were usually conducted in a place where respondents were not overheard, but where they could be seen, and that was the case definitely when we were interviewing children. For quality control, we adopted a number of measures, such as unobtrusively and with the permission of the respondent. Of course, the supervisors observed team members during the interview and then provided feedback on their technique. The supervisors also check each questionnaire for completeness and accuracy while they were in the cluster, and in some cases requested that re-interviews were done. And the team met on a daily basis to share experiences and to support each other. So Some lessons learned: data collection and data entry occurred simultaneously. So it's always best to oh, sorry, I jumped too fast. Number one, don't rush through training and field testing. These test days are very important to make sure that everyone understands the role, that the procedures for selection of households are understood, also for selection of respondents, that interviewers follow the instructions given for administration of the survey, and that the questionnaires are filled out correctly and in a way that is legible. And if you do it a couple of days before the survey starts, then it also allows you to make adjustments. Prioritize team safety. We had one team locked because of initiation ceremonies that were going on in the village. Certain clusters could not be reached because of the rains or a bridge that was broken, and it was not safe for the team to walk or to take a motorcycle. One interviewer was chased. I know Lucy will be talking about safety issues that she has encountered as well. And of course, in our case, this had some methodological implications because we had to use the reserved clusters in all domains to keep the team safe. Establish procedures for addressing
Monica.
Yeah?
Oh, just a quick time warning. Sorry.
Okay, thank you.
Wrap up.
Thank you. And also establish procedures for safe and daily returning of questionnaires to headquarters so that data can be processed quickly. Perform regular data quality checks. This is crucial. If possible, assign one person to perform the checks from day one instead of trying to do this on top of everything. And it pays off to have open communications to model those behaviors and to show your team that you're there for them. It will not only make the work more pleasurable, but it will also help you detect and correct problems early on. And of course, take care of yourself and take care of others. Data collection and data analysis occur simultaneously. This is always best to start entering and cleaning data as it comes from the field, and also to detect weaknesses and correct quality issues early on. The data analysis involved not only the analysis of survey data, but also constant back and forth with the qualitative results emerging from the individual and the group interviews to validate themes, to describe patterns. For example, the survey explored attitudes towards childbeating. Well, those same attitudes came up in the group discussions, plus other forms of physical punishments that were described during the focus groups. So we were able to better understand how adults and children experience corporal punishment and the different forms that it can take in the communities in this study. So some tips. Again, it's crucial to perform quality checks during data processing, checking for completeness, for plausibility, skip logic as the questionnaires come in, and provide quick feedback to the field teams for correction. Keep track of all the decisions made. Budget generously for coding, keying, transcription, if it's necessary, translation. It was not our case, but this always includes factoring in your timeline and start recruiting early so that as soon as the information comes in, you have the support staff available and more than one person, because it's good to duplicate data entry and to conduct spot checks. Conduct preliminary analysis with all team members and with the advisory committee separately. It's particularly important to bring together the group, focus group discussion facilitators and the survey enumerators and supervisors. In another project in Laos that I'm doing, the issue was bringing together the teams that had applied the same method in different provinces. And this helped reflect on things that worked, that didn't work, that surprised us. It allowed for themes and similarities and differences to emerge, which later was very useful to guide the analysis, and also provides tips for improving the process in the future. And plan time to do all of this, including integrating the mixed methods. So in the last stage is the stage of dissemination and use. The findings from the study were were disseminated through a survey report that was distributed to the stakeholders and presented through 7 work groups in Monrovia and in other counties. An advocacy document was also drafted and presented at a high-level meeting with national government and UN partners. A number of academic publications and international presentations have been done or are still being produced. And information from the baseline survey has been used in planning program activities, not only within this project, but also in other areas such as education and health, because the survey provided information about, for instance, differential treatment of children in regards to schooling and access to healthcare. So final tips from this stage is good to develop a data dissemination plan and to identify individuals and organizations, both domestically and internationally, who can use the findings, whether it's for programming or for policy making or for advancing research. It's good to do this early so that you might build strategic partnerships during the study. In our case, the advisory committee continued to meet and to review other research after the study ended. And the diverse and strategic composition of the committee, I think, was important to facilitate the dissemination of results. Tailor your findings and means of communication for different audiences, including child-friendly reports and community workshops. For instance, in Liberia, child welfare committees are active in many communities, and so they could benefit from these findings, but also from for peer-reviewed journals and public presentations in conferences. And finally, remember that the study was conducted as a baseline before the services were implemented in those districts. So in fact, the findings were used for advocacy and for communication and for social mobilization and family reunification activities. And while CAP cannot prove causality, it can provide a snapshot of community awareness and beliefs and practices before and after the intervention. So the results from this baseline will be useful for the purposes of measuring program results and for tracking the progress achieved during those years of intervention. So I will end with my cheery mantra during the training and in the field. I truly believe that studies such as this one can only happen in collaboration and with each person giving their best.
Thank you, Monica. Now I'll pass it over to Ghazal to introduce Dr. Lucie Cluver.
Thank you. Good morning. Ghazal Kashavarzian with the CP Merck, and I'm pleased to introduce Dr. Lucie Cluver, who's an associate professor at Oxford University and the University of Cape Town. She works closely with UNICEF, WHO, PEPFAR, and the South African government to develop rigorous research with children affected by AIDS. She's lucky to have exceptional collaborators and a dynamic team of doctoral and postdoctoral students who are all slightly cleverer than her. And she's a South African social worker. Today she'll be talking about the logistical, ethical, and safety dilemmas of research with AIDS-affected children in South Africa. Over the past 7 years, they've interviewed over 10,000 children and caregivers, conducted longitudinal studies where children were followed up into prisons, hospitals, and other countries, and run large-scale randomized controlled trials of interventions to support families. She would characterize fieldwork as semi-organized chaos, punctuated by mistakes, political riots, and community violence, and that's on a good day. So I'm pleased to pass on the microphone to Lucie.
Lucie, it looks like you are still self-muted, so if you could unmute yourself.
Am I unmuted? Can you guys hear me?
Yes, thank you.
Well, I would like to start off by saying that's an absolute typical thing, is me messing up the technological logistics of something. So that's a good way to start, which is that Monica's presentation was fantastic, and she really talked about what you should do in research. But what I want to talk to you guys today is more about what happens when you've done what you shouldn't do and when things go wrong. And sometimes they're your fault and sometimes they're not your fault, and it's just the nature of doing child protection research. But to think together about how we can cope with some of the kind of daily disasters that come up in a fieldwork project. And I think that often these daily disasters are even more pertinent when what we're doing is child protection research, which has both more resting on it. There's very high stakes in what we're doing, but also many more opportunities for things to go wrong. So just to whiz through in a few seconds the work we're doing, I do a collaborative research with the South African government, with colleagues at RETSI and UNICEF and Save the Children, with USAID PEPFAR and with the World Health Organization, with a bunch of brilliant academics. And you can see at the bottom, that's a photo of a camp from, that's actually 2008. That was our teen advisory group, who are 20 AIDS affected and child protection issues affected children who we work with. So just to summarize, these are some of the projects that I'm just going to be touching on and the experiences. This was the world's first longitudinal panel survey of AIDS-affected children, with 1,000 children who we followed over 4 years. And you can see on the right, we did questionnaires that are designed with our teen advisory group to be child-friendly and kind of cool. You notice we also had to put some little boxes over. This is a lady from Generations, for anyone here who's South African. We had to put boxes over her chest because the ethics committee objected. But I'm also going to talk about some of the problems we had in a national longitudinal study that we did, which has had a lot of child protection work in it. And this was with around 7,000 children and 2,500 of their caregivers all over South Africa. And we followed them up a year later and got a quite astonishing to us 98% retention rate. But I'll talk about some of the issues that came up. And then the last project that I'll be touching on is a randomized controlled trial that we're just starting out at the moment. And this is really very focused on child abuse prevention, and it's adapting evidence-based child abuse prevention programs which have been developed in the West but cost large amounts of money. And we're essentially making free accessible versions for sub-Saharan Africa. If we get it right, the World Health Organization want to roll them out throughout low and middle income countries. If we get it wrong, I don't even want to think about it. It makes me wake up at 4 o'clock in the morning feeling sick thinking about getting it wrong. Right, so what are we going to talk about? The first big thing that I want to talk about is where timetables go to hell. And this is absolutely typical of fieldwork. You've got this beautiful timeline, you've written it up on your office wall, and then something or multiple things go wrong. Now this can be because of external factors, it can be because you've estimated the timing wrong. It can often be because contracts or budgetary issues come up, your funding doesn't come through in time. It can also just be because you're working too hard and your staff are working too hard and your level of sort of quality of work and capacity goes down. And I think that's really common actually in our type of research, and also in the type of people that we are. That we choose to do this kind of work, and we put our everything into it, and often we run ourselves into the ground. So what are some things that can help? The first thing is just accepting it's not going to be perfect, making a plan B. If you're the team leader, have your secret plan C and occasionally a plan D. I try, although I haven't done it at the moment and I'm in a bad situation because of it, I try and have some slush fund money for when things go wrong, which can allow you, sometimes it really just helps to throw money at a problem. And I'll give you an example of that in the next couple of slides. One thing that I found absolutely essential is to force your team to tell you as soon as things start going wrong, not to try and solve problems and then wait to tell you. And they'll often do this because they want to impress you or they don't want to seem like they messed up, but actually it just makes everything get worse. The other thing that I've really had to learn the hard way is that when you mess up, you apologize to your team. And I find that really hard to do, and yet I hope they really appreciate it. Either that or they're just very polite. So the next thing that I want to talk about is serious safety concerns, and I think this is very important for any kinds of large-scale community fieldwork, but particularly for child protection fieldwork, where the very nature of what you're working on can be very tense. It can be very difficult both within families and in communities. Now this kid on the side you'll see, he's actually called Doctor. He's a lovely kid, and the reason there's a picture of him is that he was one of the kids in a longitudinal study that we had, and he was asked to join a gang, and when he refused, they stabbed him, and he had to leave, and he actually left the country because of it. And it just makes you think about the levels of violence that's going on in the community and in the homes that we're working with. And of course we see high levels of risk for all of our field staff. Two of my team were robbed at gunpoint 2 weeks ago in a township in Cape Town, and I had to find myself negotiating with the police, who said that they couldn't patrol there because it was too dangerous, and then going and negotiating with local crime bosses to negotiate effectively gang protection for your team. Now, of course, that's when your emergency slush fund comes in very handy, because the European Union or many other funders aren't too happy to pay for gang protection. So some of the things that might help: putting together very rigorous safety protocols can be really useful. We spent about 6 months putting together ours, and if anyone wants some safety protocols, just email us and we'll send you ours that you can adapt. It's obviously very helpful to liaise with communities and community leaders. This can be tedious. It's endless community meetings of where they're fighting over who gets to host the local political rally, and lots of delivering gifts to chieftains, but absolutely essential. In urban areas with high crime rates, it's also very helpful to liaise and work with the crime leaders in the community, who can often actually be very helpful to you, especially if they see that what you're doing is helpful for their community. We have a whole set of safety procedures, but as Monica says, you have to make it the priority. And things like traveling in pairs, having security code words to say if things go wrong, having rules about cell phones and no traveling after dark, things like that are really important. The other thing that we often forget about is the risks in cars with any kind of field work, and something that we've really struggled with is staff having car crashes. And this is often linked actually to staff working too hard and being really stressed. So do try and get training and make sure you've got insurance for all drivers, and don't let anyone who can't drive properly drive. So the next thing that often comes up, and which I've been hinting about, is some of the emotional difficulties that come up in this kind of field work. And this is, you'll see the picture is a child drew this in one of our projects last week. He was talking about being HIV positive and saying it was like a devil in his body. And what we often get is that we as team members and staff find this incredibly difficult to deal with day in, day out. And I think all of us who work in child protection know this. And sometimes we're quite good at dealing with it for our colleagues, but we're often not very good at dealing with it ourselves. And we often don't realize that things like our exhaustion, our arguments with other colleagues, and even our arguments, back home with our partners and children, can be related to this kind of overexposure. Now, in some ways this is the nature of the game, but there are some ways that can be helped. One of them is to have regular supervision for everyone, and if you're a team leader, for yourself as well. We enforce holidays and we enforce treats for our team. We send them off on outings, we buy them spa vouchers, anything to kind of let them, force them to take a bit of time off. The other thing that I think does help us, especially when you're doing epidemiological research, is to do action. If you have a severe child protection case, make a referral, do something about it. I think that powerlessness is often what can be very difficult. So then what do you do when your methodology goes absolutely haywire? And an example of this is that we were working in a whole bunch of areas in South Africa which then had severe political violence. And our entire beautiful stratified random sampling fell to the ground in a mass of burning tires and rubber bullets. And essentially, our stratified sample just went out the window. I moved the entire team over the mountain where it was safe, and we did the research there. So what are some of the things that you need to think about here? One is that not everything has to go into the peer-reviewed publication, and you kind of have to do the best you can. One thing, though, is that it's really helpful to communicate with your funders when that kind of thing happens. They're often very understanding if you tell them at the time, but if you wait until the end or until you're found out, it's not, it's sometimes they can be upset or they can feel that you've lied to them. So what about when the ethics get really tricky? And Monica mentioned this, and there are a whole host of ethical issues. We all know that with child protection research. But some of the key ones that come up with are in terms of consent. We have these beautiful consent forms that the IRBs love, kids completely interested in 2 pages of close type, and what you have to do is really summarize it and condense it and make it clear to them. One thing that we found really helpful is to have kids make up their own pseudonyms. Often it's Beyonce or Sean Paul or Usher or something like that. But we're saying we're going to use a name for you that's not your real name. And that helps them to understand what anonymity means. It's also really important not to provide perverse incentives. And one thing that I've seen happen often is that staff are paid per interview. Now that means that they're incentivized to pressure children and their caregivers to take part. Otherwise they've lost all the time that they've spent getting to them and talking to them. It's also, of course, issues when you have abusive guardians or no guardians, is how do you get guardian consent? And something that we've arranged with our ethics committees is that if there is an abusive guardian, the child can get consent, adult consent, from another adult who they nominate. So that can be their teacher or a social worker if they have one, or an aunt or a cousin. Of course, that's never simple, and we try not to do that unless it's absolutely essential. What are some of the things that can help? It can be very helpful to have a qualified social worker or psychologist to supervise field staff. That's really helpful because in a sense, you can't anticipate all the problems that are going to come up. Do, as Monica said, make friends with your ethics committee. Don't make either payment or success or praise only relevant on numbers reached for staff, because that does lead to perverse incentives. And I think something that I found particularly important here is being really strong for your team. The team essentially needs someone who they can turn to and say, here's an intractable ethical problem, what do we do? And sometimes they just need an answer. Even if you're not 100% sure that it's the right answer, sometimes you've just got to move forward. So one of the last things that I want to talk about is, great, I've got 3 to 5 minutes, that's good, I'm nearing on through. Is when we do make referrals and when we do respond to severe cases of abuse, and the ethics and the social services systems in where we're working just can't deal with them. Now we know why. It's staff burnout, it's lack of transport, all the things that we know about. But this can be really distressing and difficult for us. And some of the things that do help are, before you start the project, map out what services are available so that you at least have a spectrum of what you can and can't expect to do in your referrals. We try and find good people. You'll often find within even a bad system, there's one good individual who will really make things happen. And we find them out, we buy them boxes of chocolates, and we talk to them. Do have emergency protocols. For example, if a child in sub-Saharan Africa in particular has been raped in the last 72 hours, you don't mess around with any of the complex things about consent and speaking to the parents. You put them in the back of the car, you take them to hospital, because you've got a chance for post-exposure prophylaxis for HIV prevention. So do have the team be aware of these particular safety protocols. And another thing, when I talked to my team about this, that they said was that it's really helpful to talk to field staff and train them in advance on what to do when a child discloses to you. So for example, we're often very shocked when a child discloses abuse, but if we've been trained to give responses like, it's not your fault, then the experience is much better for the child. Something that we all know about is the difficulties of longitudinal follow-up, and we know why it can all go to hell, but some of the very briefly things that can help are getting names, addresses and cell phone numbers of people who'd be able to find them in the future. Giving kids certificates can be really good. If you make the certificates really beautiful, they'll keep them and they'll hang them up in their house. And then when you go back to their community, even if they've moved, then people will come up and say, oh, I've seen a kid with that certificate, and they'll take you to the house. Sometimes it's a different child who's still in your sample. Do set more money aside for the longitudinal follow-up than you needed for the baseline. People often assume you need the same amount. You don't. You need more because you've got try harder to find them. And be tenacious. This is like being Sherlock Holmes, my team always say. So just to finish up, I want to talk about what you do and how you disseminate your findings. And sometimes there's a kind of myth that if you do good enough research that somehow the world will know about it. The world will not know about the paper that you publish in some journal, even however good the journal is. So the key thing is marketing and disseminating. And I often think this is a bit like being a sort of low-grade sort of rock band on a cheap world tour where you find yourself in strange places in nasty hotel rooms giving talks. On the right, that's two of our kids in our qualitative research doing some dissemination. They're actually dressed up as government officials there. But do make a list. Who needs to know this? Who needs to know the findings? And think about this at different levels, at the level of the community you're working with, and then reaching out, right out to international levels. If you engage with these stakeholders very early on in the planning stages, they're much more likely to be responsive to your findings. Do ask them how they would like the findings. Sometimes they say, I want a policy brief. Sometimes they say they want a presentation. Sometimes they say they want a report, but I would tend to ignore that because they tend never to read the reports. And do use the media for your results. You can have real effect if you use the media. The last thing is about how do you present and having that kind of zing impact that can really make a difference. Well, I think the single most important thing here is to have a very simple, clear message. If you look to the right, the message here is that if you give children a child support grant or an unconditional cash transfer, for girls, it reduces the rates of transactional sex by half. That's your simple, clear message. If it's that simple and that clear, people will get it and understand it. If people didn't understand that, do let me know. But that can be really helpful in conveying what you're getting across. The more complex we make it, the less likely people are to get it. Publishing in peer-reviewed journals can be really helpful. It's not helpful enough to do it on its own. It only works with active dissemination. And do give credit to all the people who've been involved as the project's gone along, although sometimes I always forget someone. So this is just an example of a study that we published recently that went all over the media. And sometimes it's hard to predict what's gonna get taken up and what isn't. But some of the things that we found in our studies are extremely high levels of child maltreatment, all types in AIDS-affected families. We've seen that the combination of being in an AIDS-affected family, abuse and hunger, leads to very high levels of HIV risk behavior, so from 1% in a healthy family to 57% for children in families where they're AIDS affected, abused and hungry. We also see that provision of cash transfers and positive parenting and teacher support can interrupt these pathways. You can see the pathway between poverty, abuse and risk behavior. They can act as an interrupter. So there can be some real positive things that come out of this research where you find out what really works. And just to finish off, I want to finish off by saying thank you to our funders, but also never forget to say thank you to your funders, because without them, none of this would happen. And to end is better words than me. This is one of our kids in our teen advisory group, and we asked her what she wanted other kids and the world to know. And she says it better than me. So thanks, everyone.
Thank you, Lucie.
Hi. Yes.
There.
Okay. Thanks, Lucie, and thanks, Monica. This is Lucie Hillier speaking. Just to confuse you all a little bit, I'm known as the other Lucie, and I'm the coordinator of the Community Child Protection Exchange. We've practically filled up our time. We've got about 8 minutes where I thought we could, we've got quite a few questions that came in. I thought perhaps we could ask Monica a question and also Lucie a question. We've had some really interesting ones. Perhaps we can try and answer some of them online, but I think to start off with, I wanted to ask Monica a question. Something that came up, Monica, you gave us a really in-depth explanation of how you went about doing your CAP study, but also you gave us tips. But one question which came up was, how did you actually do this on a shoestring? Because it seemed like quite an ideal situation. And sort of as a secondary question to that, another way of looking at this would be, how would you help NGOs understand the complexity of what is required to obtain good research? So I guess more, you know, like maybe you can give us an example of something that went wrong that you had to fix. Thanks, Monica.
Yeah, thank you. One of the advantages of CAP studies and the reason why they've been used so often is because compared to other social research methods, they're actually rather cost effective. You would think, maybe I gave the impression that we had lots of resources, but we actually didn't have that many. Most of the staff were either from the local partner NGOs, some were students, so it didn't really have a big budget. We're not talking even about big thousands of dollars. There was big commitment from all partners, and that's also how you find additional resources. Not there was, you know, any everybody was compensated for their work, but we didn't give, for instance, we didn't give monetary compensations to any of the persons interviewed. Lucie talked about the dangers of using compensation per interview. We didn't do that. Both for the interviewers as well as the caregivers and the children. We did provide some refreshments at the group discussions, but really the cost was not that high. In terms of troubleshooting, precisely because there were limited resources, you had to be ready, and I definitely did, and many other team members did, to wear many different hats. And this, if something conflicts with take good care of yourself and of your team. So that means that, you know, if I had photocopies had to be done because there were some questionnaire missing in the field, then I had to do them, I did them. So sometimes you have to be ready to take on tasks that are not, you know, the prescribed for your role, let's put it that way. I think with everybody's willingness to participate, and that's why I say it's teamwork to cover up. An interviewer falls sick, and someone else has to take a piece of that work. The supervisors, we had to ask the supervisors to conduct a few interviews as well, precisely to lighten a bit the task for the teams, for the interviewers in their teams. So the ways in which, with limited resources, everything has to be balanced out, and that's why I said it's important to be aware of trade-offs and the cost in terms of, you know, physical tiredness, but also the impact it has on quality.
Thanks, Monica. That was a great answer. And I'm trying to squeeze in. I just wanted to say, actually, Monica, there's quite a few people who want to ask you things very specific to Liberia. I'm suggesting that if you've got a second, you could go online and just maybe answer those in the chat. I just wanted to squeeze in a question for Lucie. So, in fact, there was another person who asked a question about how thin is the shoestring. And I think, Monica, you went away to explaining that it was pretty thin. Lucie, you might want to add what they're asking, like a ballpark figure of what it cost. You might want to add what you think. And a very specific question that somebody asked was also, how do you balance the need for high response rate with perverse incentives? So you highlighted as a problem or potentially a problem, but how did you actually deal with that? So I think we can squeeze in that, and then I think after that we'll have to answer the questions in the chat manually. Thanks.
Great. So this is a great question because, of course, you know, what you really want in a good study, for the study to be accurate and the study to be scientifically rigorous, is you want a very high response rate, because the lower the response rate, the less sure you are about whether your study is representative. But at the same time, you've got to prioritize the fact that respondents do need to be able to refuse, and particularly the more vulnerable your respondents are, the more care you need to make to try and make sure that they can refuse to consent. And you know, I think we've been, and maybe Monica can help with this, we've been in an unusual situation in that we've never had a child not want to take part in one of these studies. The very rare times that we've had refusals have always been because either the parent or the guardian is abusive and doesn't want the child to take part because they're afraid of what will be disclosed, or that the parent's sometimes involved in some kind of crime, like they're drug dealing or they're something like that, so they don't want the child to take part in case that gets disclosed. And so we found consistently that reassuring and talking and being willing to talk in quite a lot of detail and discuss with the participants what the project's for, what will be done with the findings, and in a sense how confidentiality and anonymity works. And of course it works a bit differently with child protection cases, which we all know. But that can be really helpful, is having research assistants who can actually have a discussion about that. And I find what's very helpful is to actually talk to the research assistants about what kind of dissemination we're doing, because often we don't tell the field team about, you know, we went to talk to Save the Children, and we went to talk to the South African government, and we've been at UNICEF, and we've talked, and they've changed this policy because of this. But if you tell them that, then they can go back and tell the potential participants, oh, well, what the kind of thing that happens with this is we put it together with 4,000 other responses, and then they go and tell UNICEF so that they can change child protection policy. That can be a really helpful dynamic. But I think it's just a really tricky one. And the answer to the question, how much does it cost? Well, it costs different amounts in different countries, but it always costs a lot more than you think it will. So the Young Carers study with 6,000 children, well, it was about 8,000 respondents followed up over a year, cost about £2 million, which is what now about $2.5, $2.7 million. The current randomized control trial we're doing is a whole set of pre-post studies and a randomized control trial, and that's about, again, about $2 million. Just under. So they're really expensive. It's a big shoestring.
Can I add on that one that, yeah, for the Liberia study that I described, it was really, I mean, comparing to what Lucy just said, it was about $40,000. So I think it qualifies as shoestring, and definitely, and that's why I think that there should be even more slides thanking everyone for the big effort that everyone made to make it happen.
Well, you guys are heroes then.
Lucy and Monica, I think we're going to have to end, which is a real shame, because I think a lot of us could spend all afternoon, well, afternoon in my part of the world, which is Johannesburg, asking you a lot of questions, because it's really fascinating to get down to the nitty-gritty of what really happens when you start to try and implement your carefully laid plans. And I'm impressed that, Monica, your research only cost $40,000. That's amazing. But Lucy, I also empathize with power cuts and the violence as I sit here in South Africa now. So thanks so much to both of you for your time, your wisdom, your encouragement. I hope that it will allow people to get a sense that they can also plan for these kinds of research. And I think just to let everyone know that we will have a recording of this on all our respective websites. I think it will not be up for a couple of days, so just bear with us and be patient. You're welcome to email any of us and ask questions or ask for follow-up, any of those things. And we'd like to thank you for wherever you may be for joining us. I think it's been a great webinar, and we're hoping to have quite a few more like this. So I think with this, I'll just let you all, Lucy, Monica, say your goodbyes, and we'll end this webinar.
Bye, everyone. Thank you.
Thank you. Thank you, everyone, for coming, and thank you for the invitation.
Thanks, Lucy. Thanks, Monica. Okay, bye, everybody.
Bye-bye.